My name is Rachel Bath. I'm a consultant in public health within the Health Improvement Division at Public Health Wales. And we're absolutely delighted to have the opportunity to present to the Public Health Network this afternoon. So the Children's Nutrition and Healthy Well team sits within the Health Improvement Division at Public Health Wales. Can we put on to the next slide, please, Lily? And alongside our colleagues within our physical activity team and education settings team, we all work to support schools to be environments that promote health and well-being. So today we're going to focus on school food provision as a public health intervention. And I'd like to get started by hearing from you what comes to mind when you think of school food. Should be a poll coming up, so yeah. Jamie, I'm not able to see any of the answers coming up in the word cloud.
It might be that you have to put one in and then it might show you.
I'm starting to be able to see it now. So we've got, as you should be able to see on your screens, we've got nutritious at front and center of the word cloud, which is great. But then in contrast, we've also got unhealthy there, beige, but nutritious is staying front and center, which I'm really pleased to see. So thank you, everyone. I think the poll will be open for a couple more minutes if you want to keep adding to it, but we'll get started. And if you go to the next slide, please, Lily, thank you. So just to clarify that when we first had planned to run this session, the Welsh Government consultation on the healthy eating in schools regulations was open, and we were intending to focus the whole session more around the regulations. But unfortunately, we had to postpone the webinar, and that consultation has now closed. But this means we've got the fantastic opportunity to consider school food in its broader context. So we're hoping by the end of the session today, everyone will understand the role of school food as a public health intervention, gain insight into the current opportunities in Wales, and learn from some practical examples that are already being put in place by local partners and stakeholders. So I'm now going to hand over to Lily, a registered nutritionist within my team, to tell us more about the importance of children's diets.
Thank you, Rachel. So over the past 12 months, the school food team has had the fantastic opportunity to visit a handful of schools to understand the views and experiences of children and young people with their school food. And I'd like to start by telling you about Harry, a 10-year-old growing up here in Wales. So on some days, Harry arrives at school hungry. He didn't have much breakfast, and by mid-morning, he's already pretty tired and distracted. At lunchtime, he might only pick at his food, maybe eating only the chips and leaving the rest behind. By the afternoon, his energy has dipped, he's struggling to concentrate in lessons, and he doesn't feel like joining his friends running around the playground. But on other days, Harry has a very different experience. He sits down to a warm, balanced school meal, colourful, tasty and nourishing. He eats with his friends, enjoys the break and goes back to class full of energy. He's more focused, more confident and ready to learn and play. So Harry has two very different school days, which shows us something really important. School food isn't just about fulfilling the stomachs of children. It's about fueling children's health, learning and their happiness. And here in Wales, we have a huge opportunity to make sure every child has more days like Harry's good day through our school food system, our standards and the amazing work happening across communities. That one. So school food is something that we've all had experiences with, whether this be back in our schooling days or even more recently through our families, our children, grandchildren. So hopefully a word cloud should be coming up now. What is one thing that you remember from your school food? I better put my answer in so I can see yours. Spam! Ooh, beef stew and dumplings. We are getting into that season now. I'd love that. Loving it. Large portions. Got a lot of puddings on there. What else have we got? Enjoyable. Custard standing front and centre. Three-way plates. Yeah, they're still about. Pink custard. Yeah, we used to call it tubby custard in our school. No choice. Larger portions. Fat. Well, thank you for sharing those. I'm sure it's a little bit of a throwback, and it's always good to reminisce. So yeah, like we said, school food is really, really important, and it's one of the reasons why it's important is due to children's diets. So during childhood, children can experience rapid growth and development, including physical, social, and cognitive and emotional milestones throughout this time period. A healthy, balanced diet during this period is essential for healthy child development. It fuels the body for daily activities, providing essential nutrients for bone growth and muscle development. It supports the brain development, impacting cognitive functions like problem solving, helps children feel at their best, and helps to improve concentration levels, which supports learning and those achievements throughout the school day. A balanced diet from the start can really help to shape their eating habits in a positive way throughout their life and promote a healthy weight and avoid future health conditions and chronic diseases. So what do we know about children's diets today? So the context of food and nutrition is that the diets of many children and young people in Wales fall short of what is needed to benefit health and prevent disease. The majority consume inadequate amounts of fruit and vegetables, oily fish, fibre, and eat too much saturated fat, salt and sugar. Like the rest of the UK, the National Diet and Nutrition Survey data for Wales found that from 2009 to 2017, there was little change in the consumption of these key nutrients and the consistent increase in high fat, salt, sugar foods. During adolescence, most young people do not eat breakfast every day, and the daily consumption of energy drinks and sugary drinks is high. Alongside that, only 45% report that they eat at least one portion of fruit and vegetable per day. So the children's diets in Wales. So children and young people in low-income households are more likely to have diets low in fibre, fruit and veg and minerals compared to higher income households. But we know the majority of children as a population, unfortunately, do not meet these recommendations. In Wales, there's 13.7% of the children are overweight and 11.8% obesity overall, higher than our neighbours in both England and Scotland. Obesity was the highest amongst the most deprived fifth and lowest amongst the least deprived fifth, and this trend has been shown to increasing over the last 10 years, thus resulting in a need for change within the system. In a recent Food and U2 survey, it was shown that 27% of respondents had experience with food insecurity over the last 12 months, and increased deprivation was associated with a reduction in the proportion of children with a healthy weight and increase in children with overweight and obesity. These stats then are the driver for the improvement within the school food system, and working together, we need to ensure that children get at least that one nutritious meal per day to really help them along the way and set their path for the future.
Thanks, Lily. So back over to all of you. If you could post your responses in the chat, we'd like to know, having heard about that from Lily, what words would you use to describe the role of schools in shaping food culture? Thanks, Andy. Yes, very important. Opportunity, potential. We're amongst friends here, which is great to see. So yeah, it's great that you got that. I am just going to spend, yep, keep them coming. All really important words. I'm just going to keep moving along and just spend a couple of minutes describing schools as key settings for children's health and well-being. Next slide, please, Lily. Thank you. So at Public Health Wales, our vision for children's health includes a Wales where every child is able to grow, learn and play to their full potential. So with nutrition supporting not just health, but also learning, well-being and opportunity. Schools are a really integral part of that system and are an obvious setting for population level interventions. And health and educational attainment are complementary goals. So as health and well-being underpins educational achievement, which in turn can lead to better economic and social opportunities for individuals and better health. The school setting provides an environment in which the health of children can be protected and promoted, and a healthy school food environment is an effective population health approach to support the nutrition and health status of school-aged children. So the provision of school meals in the UK goes back over 100 years and is linked to awareness and concern about malnutrition, poverty and educational standards. And today, this includes overweight and obesity as paradoxical states of malnutrition. So as you can see from the image and the presentation, the provision of school meals is just one of the opportunities within the school environment to shape children's eating habits. So alongside meals, we must also consider access to drinking water, the availability of vending machines, how food is used in school celebrations, and the powerful role of staff role modelling, whether that's throughout the day, not just during lunchtime. So taken together, these elements highlight that schools are not just sites of education, but important food environments in themselves. And supporting healthy options in these settings contributes to reducing inequalities and aligns with the wider whole systems approaches to child health and healthy weight that we are adopting in Wales. What isn't captured in this particular image is the curriculum, such as food education, cookery, but also children's understanding about affordability and availability of foods, and of course, importantly, sustainability. These play a crucial role in building skills, confidence, and lifelong healthy eating habits. So by recognising all of these touch points, we can see how the school food environment offers a unique opportunity to support healthier choices today, while shaping children's well-being across the life course. If we were to maximise all of the opportunities that we have available to us and ensure the provision of nutritious food throughout the school day in a sustainable environment that promotes positive social and cultural relationships with food, no small ask, I'm sure, short, medium and long-term benefits can be achieved. And these benefits broadly fall into the categories of fair and equal access to healthy food and drink whilst in school, which prevents hunger and supports household food security, contributing to the consumption of a nutritious and sustainable diet and the development of food life skills, healthier food preferences, norms and behaviours, and then supporting educational achievement and helping children and young people to reach their aspirations for fulfilling a life and for society to benefit through then economic outcomes. So all of these impacts contribute to a reduction in health inequalities and support longer, healthier lives. But how can we go about starting to maximise the opportunities that school has for us to realise these short, medium and long-term outcomes? So an evidence synthesis that was completed by Public Health Wales in 2023-2024, which looked at what works within the school food environment in high-income countries to promote healthy eating and healthy weight attainment in school-aged children, concluded that a multi-component approach to interventions will have the most beneficial effect on the consumption of healthier food and beverages, a significant effect in improving children's healthy eating habits, and a significant and meaningful effect on body mass index. The findings indicate that school food policies, changing the direct food provision, so changes to the types of food available, the variety, the quantity, and increasing the availability of healthy foods alongside nudging interventions, so involving the placement, presentation and promotion of healthier foods, nutrition education and family support and involvement are all really promising interventions. However, the evidence did indicate that the implementation, the school context and additional supporting strategies are factors that influence the effectiveness of policies and interventions. And this includes how partners within the school system interact and work together to achieve shared outcomes. And as you can see on the slide, it's just an image of all of the different stakeholders that are involved within the school food environment at different layers, from the school setting up through to the community and also at a societal and political level as well. Next slide, thank you, Lily. But we must remember that children's food environments extend well beyond the school gates. So whilst we can strengthen the school food environment, and that's essential, it is only one part of the picture. And a whole systems approach is needed, recognising the role of families, communities, high streets, digital marketing, advertising, and creating fairer food environments means addressing inequalities in access, affordability and exposure. So by doing so, we can support children's health and wellbeing today while laying strong foundations for a healthier future. So we'll now hear from Lydia Orford from Betsy Cadwallader Health Board about how they've been implementing a whole system approach to healthy weight with a subsystem focus on eating well and being active in schools.
Great. Many thanks, Rachel, and thanks for the opportunity to present the work we have been doing up in North Wales. So I'm presenting today on behalf of my colleague Laura England, who can't be with us today. And thanks must go to Laura for all her hard work in this space. So Laura and I both work within the Healthy Weight Whole System Approach team for Betsy Cadwallader University Health Board up in North Wales. And I want to spend the next 5 minutes or so talking through our Eat Well Be Active in Schools priority subsystem of our Healthy Weight Whole System Approach and our journey in North Wales over the last 3 years. Thanks, Lily. So I'm going to take you back to the start of our journey. So in 2021, Healthy Weight Whole System Approach teams were recruited for each health board area across Wales, working with the national team in the Health Improvement Division of Public Health Wales. These teams were recruited to deliver the leadership and enabling change theme within the Welsh Government Healthy Weight, Healthy Wales 10-year strategy that's on screen now. Healthy settings, which includes educational and workplace settings, was another one of the 4 key themes, alongside healthy environments and healthy people. Thanks, Lily. Over the last 4 years, we have been following the Whole System Approach Public Health Wales 9-step process, where we have been securing system setup and buy-in, defining the system definition and narratives, and engaging with the system through system mapping workshops. So these workshops started in March 2022, where we brought partners and stakeholders from across the system, many of whom are on the call today, together to map the factors that cause overweight and obesity across North Wales. Through this mapping with partners and stakeholders, we identified 97 causes, we produced 23 system maps and identified 5 key themes for this work. So a follow-on workshop was held later in the year in September 2022 to prioritise those 5 key themes identified, and resulted in agreement and adoption of 3 priority subsystems, with one of these subsystems being Eat Well and Being Active in Schools. So very much delivering on the leadership and enabling change and the healthy settings themes within the strategy. So during 2023 and 2024, the Healthy Weight Whole System Approach system was mobilised across North Wales. So during this period, we formed a strategic partnership group for the work, with subgroups for each of our priority subsystems, including the Eat Well Be Active in Schools priority. And again, some of you on the call will be part of that group. If we now go forward to February 2025, this brought the next stage of our system mapping journey, something called causal loop mapping. And this involved bringing partners and stakeholders back together and carrying out very much that deeper dive into our priorities, identifying hotspots for action and identifying the most impactful and influential parts of the system that we could intervene in. Thanks, Lily. Alongside the Eat Well Be Active in Schools priority, the other 2 priorities identified for North Wales were access to affordable and healthy food and eating well and being active in workplaces. The systems journey is outlined in detail in our strategic delivery plan, which was launched in 2023 and then refreshed again in 2024. Thanks, Lily. Within the Eat Well, Be Active in Schools priority, there are 3 main objectives which we have been working on collaboratively across North Wales. And they are supporting the provision of healthy and locally sourced food in schools, embedding physical activity throughout the school day, and supporting the implementation of the new school curriculum around eating well and being active within the school day. Thanks, Lily. So that outlines our journey to identifying schools as a priority for the system. But what system progress has been made during this time? So as part of taking a whole system approach, stakeholder mapping and building relationships across the system are key elements of system working. In order to achieve this, we have carried out stakeholder mapping and built relationships with education and catering colleagues and with key partners and stakeholders working in the system. We have contributed to the development of the new Healthy Eating in Schools regulations and responded to the resulting public consultations. Like Lily mentioned in her presentation, we have visited schools to observe lunch times and facilitated visits for others within the system. And this has contributed to both local and national policy development. We have focused on the wider school food environment, looking beyond school food. Locally, we have worked with Anglesey Education, Healthy Schools and Pippin colleagues, and with teachers and pupils to co-produce a refreshed food and fitness policy that, once approved, will be piloted initially with primary schools on Anglesey. The re-establishing of the Priority Subsystem Working Group next month will bring stakeholders and partners from across the system back together to further progress this work, utilising the findings of the causal loop mapping workshops. Thanks must go to all the partners and stakeholders for their commitment, support and enthusiasm for taking a whole system approach in this space. I hope this presentation has given you a flavour of our journey in North Wales in taking a whole system approach to eating well and being active in schools. Please do get in touch if you'd like to know more or if you work within North Wales and would like to be involved. Thanks very much. Diolch yn fawr.
Thanks very much, Lydia. You have very succinctly condensed a huge amount of work into a short number of slides. So yeah, if you're interested at all, I would recommend getting in touch with Lydia and Laura because their journey's been fascinating and there's lots that we can all learn from what they're learning in North Wales. Now I'm going to hand over to Lucy Jane, who's a registered nutritionist in our team, to start going through some of the opportunities for school food within Wales. Thanks, Lucy.
Thanks, Rachel. Afternoon, everyone. So over the next few slides, I'm going to be talking about the role of school meals, including the universal primary free school meals rollout and the review of Wales' school food and nutrient standards. So the Welsh Government committed to rolling out universal primary free school meals to all primary aged pupils in Wales. And this commitment was in response to the rising cost of living pressures on families to tackle child poverty and ensure that no child goes hungry in school. Implementing UPFSM also has the potential for wider benefits as well. So this can include improving social skills at meal times and improving behaviour and attainment. So this has been available to all pupils since last autumn 2024. So following the rollout of the UPFSM, the Welsh Government committed to reviewing the food and nutrient standards for primary schools in Wales. So the Healthy Eating in Schools regs address what food and drink can be provided in schools and also provides guidance on the responsibilities for promoting healthy eating and drinking in schools. So a review was required because there have been changes to UK dietary recommendations since the regulations were last updated in 2013. So these needed to be addressed. And it was also a good opportunity to maximise the potential of school food post that UPFSM rollout, being able to take into account current dietary intakes of children and also the food environment that we live in now as well. So there's been a core working group with representatives from a range of organisations to update the regulations. Once drafted, the public consultation was open for 10 weeks. That was earlier this year from May to July. And then over the past few months, these responses have been evaluated by Welsh Government to inform the final review. So then the next phase is working towards implementation, which is planned for autumn 2026. I'm just going to give a really brief summary of some of the changes that have been made. So this won't be all of them, it's just a bit of a summary. So there will be an increase in the amount of fibre and a reduction in the amount of free sugars across the school menus. This is to align with the Scientific Advisory Committee on Nutrition's recommendations. And as Elaine mentioned earlier when she was going through the current diets of children in Wales, we know that children are consuming too much sugar and not enough fibre, which has serious health implications. So more whole grains will be provided throughout the school week, more vegetables, pulses and fruit, and also more variety of fruit and vegetables as well. And aligning with SACN recommendations, there'll also be less processed meat across the menu too, and a reduction in the frequency and variety of sweetened baked products and desserts. So these updates have the potential to help children to access a varied, interesting and nutritious menu during the school hours, making healthier food choices, and also helping them to develop those healthier eating habits that they can take forward into adulthood as well. So overall, supporting health and enabling children to reach their full potential. So the next stage is implementation of these updated standards. So this includes a phased timeline to ensure that those updates are implemented practically and effectively with consideration of operational aspects, and continued collaboration across multi-organisations as well, working together to support all the mechanisms required for success. So this can include supporting potential reformulation, refinement of statutory guidance, pupil and public engagement, data collection, looking at training support and also mechanisms for monitoring as well. So I'm going to pass on to Lorna now from the Education Settings team, and Gemma, sorry.
Thank you, Lucy. So we thought we would start. So I'm Gemma, and Lorna's also on the call. We work within Health Improvement in Public Health Wales, and we lead on the Welsh Network of Health and Wellbeing Promoting Schools. And we're going to talk a little bit about the programme and where we're at in terms of the development of new standards. So we thought we'd start with what is a health promoting school. So in 2021, the World Health Organization and UNESCO published the global standards for health promoting schools. And they really describe what a health promoting school is, and they describe it as a school that is constantly strengthening its capacity as a healthy setting for living, learning and working. Now, in Wales, we have the Welsh Network of Health and Wellbeing Promoting Schools, a programme that has been delivered in Wales for the last 25 years. Now, in recent years, the Curriculum for Wales and the statutory framework on embedding a whole school approach to emotional and mental wellbeing have increased the focus on health and wellbeing at a time when schools face significant challenge from recovering from the impact of COVID-19, the rising cost of living and implementation of the education reform. Now, these pressures simultaneously place significant strain on our schools due to, for example, increasing needs amongst learners and their families, and really underscore the critical role of health and wellbeing in fostering resilience and supporting academic achievement. Now, with this in mind, over the last 2 years, we have been developing a set of proposed national standards for the Welsh Network of Health and Wellbeing Promoting Schools. Next page, Lily, please. Now, these standards have been designed as an alternative to the previous National Quality Award known as the NQA, to make it easier for schools to focus on the core principles of a whole school approach that support a range of health and wellbeing outcomes. Now, they align directly with the statutory framework and embody its core values of belonging, efficacy and voice. Now, some of the benefits of this change is we're shifting from an excellence criteria, which was previously achieved by the minority, to a set of standards that all schools can, with support, reasonably achieve, and reflects the policy commitment to health and wellbeing as a core purpose of our education system in Wales. Now, we've reduced the number of standards from 73 to 22, which significantly simplifies the landscapes for our schools and enables them to identify and focus on the core components of a whole school approach. Now, these core components, if embedded, can best support sustainable shifts in school culture, ethos and practice, and supports a range of health and wellbeing outcomes. It also enables schools to respond to emergent needs as they are better placed to apply the principles of a whole school approach. Now, rather than nationally identified health and wellbeing topics, the standards support schools to identify their priorities, informed by understanding of their own needs, alongside regional and national priorities. Next page, please, Lily. So these standards for Wales describe the core components of a whole school approach, and these include strong leadership, committed to health and wellbeing. It includes understanding learner needs to inform priorities and actions, involving and engaging the whole school community, a workforce supporting their own wellbeing as well as the wellbeing of their learners, a curriculum working hand in hand with the wider practices, a positive school culture and environment that reinforces the school's commitment to health, well-being and learning, and strong partnerships that really enable the school community to access the help and support they need. Now, there are 22 standards in total that sit under these core components and are supported by a number of what this means statements, which describe the behaviours and practices required to fully embed each standard. Next page, please, Lily. Now, these national standards for health and wellbeing promoting schools, the vision is that all schools in Wales can enhance the health, wellbeing and educational outcomes of children and young people. This requires schools move beyond specific health topics and programmes to embrace a whole school approach to promoting health and wellbeing. Schools will also need to ensure that the culture, conditions and curriculum of the school all contribute to embedding health and wellbeing through the ethos and culture of the school. Now, these standards will be accompanied by a series of tools and resources designed to support schools in conducting a focused analysis of specific health topics or outcomes, and they have identified as priority needs, such as food. Now, there'll be a suite of guidance to go alongside the standards, which will help schools to understand why a standard is important, what it looks like in practice, prompts for self-evaluation, policy links, examples and references. We also have a suite of curriculum resources that have been developed and are currently in development by our curriculum team within Health Improvement. And these have been developed over the last 18 months. More recently, they have developed the toolkit with a focus on food and nutrition. And if you haven't seen this yet, this can be found on the PHW website, and we'll also include a link within the chat. They've also developed a range of others, including vaping, sleep, and more recently, they're currently developing a toolkit around relationships. We'll also be developing deep dive resources, which will include a self-evaluation component that offers schools a comprehensive overview to support the development of a whole school approach to a specific topic area, such as healthy eating. It'll be a way of schools looking closely at this topic area to understand it and figure out how to improve across the whole school. So the new proposed standards and these resources have not yet been launched. We've currently just gone through an engagement process of the standards, and these are now with Welsh Government. We're hoping to launch the standards and the supporting resources in the new year. But we're currently just about to develop the deep dive resource for food in schools, and we'll be working with our partners in this area to do so. And this will then be available once the standards have been launched in the new year. Now, our Healthy Schools coordinators continue to support schools to embed a whole school approach to health and wellbeing. And I encourage you to get in contact with your local coordinator if you need further support around school food or any other health and wellbeing topic area. Thank you.
Thanks, Gemma. So we didn't have opportunities to go into all of the different opportunities we have across Wales. So the last one that I'd just like to spend a few minutes running through is the Reducing Inequalities in School Food Environments, the RISE study, which funded by the UK Research and Innovation, UKRI, from April this year. RISE is a 3-year research programme which aims to improve the provision, uptake and consumption of school food. So it's being delivered with partners from being led by Cardiff University and partners including LASA, Newcastle University, Queen's University Belfast, Glasgow Caledonian University and Public Health Wales. The project will explore school food provision, uptake and consumption across the UK. In Wales, researchers will work with 2 local authorities to assess the nutritional quality of menus. what children eat, and whether the universal free school meals policy is meeting its aim of ensuring a healthy, balanced meal. Surveys, interviews, and annual monitoring will generate evidence to inform improvements in provision and uptake and to promote healthier choices for children and families. So RISE will give us real-time evidence on what children are actually eating in schools, not just what's on the menu. So for the first time, it will help us to see patterns of uptake, as well as barriers and enablers to uptake and consumption of universal free school meals, so we can understand whether the policy's core aim, a healthy balanced meal for every child, is being realised. It also will bring in the perspectives of school staff and parents, and this will help show us how the wider community and societal norms shape food provision and uptake within the school environment. And then by working directly with the two local authorities, we'll be able to test new approaches alongside those delivering them and get rapid feedback on what works in practice. Most crucially, RISE boosts Wales's capacity at a time when frontline staff in catering and education are already really stretched. So it's going to allow us to dig deeper and achieve insights that would normally take years. So effectively accelerating our ability to respond and improve. It will also seek to strengthen the data infrastructure around school food that we have, helping us to better track whether policy and practice are delivering for children's health and well-being, and adapt quickly if they're not, whereas at the moment we don't have any of that data infrastructure available to us. So RISE gives us a real opportunity to make school food work better for children. Next slide, please. And we're now going to hear from Shelley, who's going to talk to us about a more embedded, we've heard about the whole system approach from Lydia, and now we're going to hear from Shelley about school food as part of that whole system approach to children's health in Cwmtaf.
Lovely, thanks Rachel, and thank you for the invite today. So as Rachel said, my name is Shelley. I am the Dietetic Professional Manager for Public Health in Cwmtaf Morgannwg University Health Board. So I'm going to talk to you briefly about some of the work we've been doing in schools over the last few years to start having that sort of positive influence on the school food environment. Thanks, Lily. So some of you might know a little bit about the PIPIN programme or the PIPIN work that's happening across Wales. It's a Welsh Government funded pilot running in 3 pilot sites across Wales, one of those sites being in Cwmtaf Morgannwg in Merthyr Tydfil, to test a range of different approaches to work more effectively with children and families and ultimately to support healthy weights. So it's quite unique in its approach in that we've kind of got a 2-pronged approach. We've got the whole system approach, trying to change the environment around the family. And then within that, we've got a nested family-based intervention. So I think a lot of us on the call have probably had experience of interventions alone being effective, but perhaps not being enough in terms of supporting long-term behaviour change. So looking at the wider environments and settings and the wider system around families was always going to be an important one for PIPIN programme of work, but we really needed to know what our local families and partners thought as well. Thanks, Lily. So immediately that we started looking at what PIPIN would be or what it could become in Merthyr, we started to talk to our local families and gather a range of insights to actually find out what it was like to live in Merthyr Tydfil, what families thought would support them to make healthy lifestyle choices and what some of their challenges locally were. So that we could build a service, I guess, that didn't just provide families with what they needed, but with something they really wanted to engage with. And that was hugely important for us. So amongst the insight work and the data that we collected from over 150 families in that initial phase, it became really clear to us that schools, as well as leisure and play and childcare settings, families felt they all had a really vital role to play in actually supporting them to make healthy choices. So educational settings were highlighted as being pivotal in offering and exposing children to good quality food and drink, as we've already heard. Had the potential to offer space and safe space outside of the school hours in terms of active play. And almost 80% of our families actually identified schools as being the ideal place for us to deliver any sort of healthy weights intervention, because they really appreciated not having to travel to another venue. If they were already picking up children from school, they felt that was the ideal place to actually deliver a service. So although a settings-based approach through schools wasn't initially anticipated as the direction of travel for PIPIN, the strength and benefit of taking this kind of approach came directly from the families. And then when we took that to our local stakeholders and worked with Glasgow University to do some partner interviews, it became apparent that actually there was quite a network of agencies that would be able to support us in this area. So sharing what we found with our partners, getting that early buy-in into what Pippin could be or what we thought it could be, and have that shared vision like Lydia talked about earlier, in terms of a whole system approach, was really important if we were to work on having more supportive environments in a school-based setting. Thanks, Lily. What we also recognised actually is this was coming at quite a unique and important time point for us, where within our local public health dietetic team in Merthyr, we were just starting to pilot having a role within our team to specifically coordinate the Food and Fun programme. So this was to work within dietetics, but work closely with the local authority and education to get buy-in to the 12 days of food and fun that we were involved in delivering during the summer holidays. So for those of you who don't know what Food and Fun is, we've got a bit of a breakdown on the slides for you. It's basically a 12-day programme where, as public health dietetics, we upskill school-based staff to deliver evidence-based nutrition messages in a really fun and interactive way. But we've also got physical activity and lots of enrichment sessions built into that timetable, as well as a healthy sort of breakfast and lunch provision. So it really fitted with that potential for a settings-based approach, and obviously the ethos and the evidence-based messaging of Pippin to support healthy weights. Thank you, Lily. So on the next slide, I appreciate some of the text is a little bit small, but it just shows how both programmes launched at a very similar time in the summer of 2022, and how the two programmes really worked alongside each other to support not just the delivery of an intervention for a short period, but actually working to build relationships with the local authority, with schools specifically and the staff on the ground as to how they could support children and families and influence the school environment, and specifically the school food environment. So it was key for us that within Pippin specifically, we were beginning to build relationships, trust, visibility, as well as across the Food and Fun programme, where we'd seen really low engagement figures from our schools previously. So having this new post within our team was really all about getting early engagement and working with the schools to see the potential of Food and Fun. So we established some multidisciplinary steering groups for both programmes of work, which was really important to get our partners engaged in that shared ownership of the programmes. We started to develop an annual operational plan with our partners so that we could really have shared actions, that everyone was playing a role here in not just signposting into an intervention, but supporting that healthy environment around the family. And importantly, we were obviously targeting our most deprived areas, informed by the WIM data that we have. Thanks, Lily. So we had lots of partnership events initially. Lydia talked earlier about the Healthy Weights team in her area. We worked closely with our team in Cwmtach Morgannwg, had some large networking and partnership events so that we could actually map the system, map where our partners were, map the strength of relationships that already existed, and actually where we needed to concentrate our efforts to support children in school. And what we also did is trained a lot of our school-based staff to understand not just what the messages around food and nutrition were, but the important role they could have in influencing accessibility, affordability to good quality food and drink, and actually the behaviours of children on a daily basis within schools. So we did lots of work running workshops, troubleshooting issues in the school environment, sort of co-developing solutions within schools, and really taking sort of a collaborative settings-based approach so that we were supporting healthy environments within our primary school settings. Thanks, Lily. This was all happening at a time where the universal free school meal provision was coming in, where we had a new curriculum for Wales, for example. And what was really important when we did have a new curriculum, it actually gave a real strength and importance to the work we were doing from a local authority and education perspective. So we knew anecdotally from working with the staff that often, whether they were teaching staff, whether they were learning support assistants, they really struggled with having the knowledge and confidence to deliver some of these messages and speak to the children around health and wellbeing. So at the time I was chairing Public Health Dietitians in Wales, and we linked up with our community and adult mental health dietitians in Wales to start asking school-based staff around if they felt they had the skills and confidence to implement health and wellbeing messages on the curriculum. So you can see from this slide that at this point, I think we've got, I checked this morning, about 340 responses from schools across Wales, and 50% of those are reporting no training around food and nutrition, 75% not being confident to be able to deliver those messages, and importantly, 97% finding resources really helpful. So that's why it's lovely to hear some of the resources that are coming through from Public Health Wales, because we certainly appreciated that there was a gap here and we had a vital role to play in upskilling and supporting staff if we were to maximise the impact of Pippin and Food and Fun, and the need to work with those staff really closely to make sure they had a central point to come back to support them with those messages. Thanks, Lily. So moving on to the next slide, we have seen, greater engagement with both programmes than we ever anticipated at the beginning of this, and overwhelmingly there have been really positive short-term behaviour change. But I think what's so important is that we look at that in terms of actually how we influence the wider school environment beyond those interventions. So we've seen a massive increase in food and fun provision, an increase of over 800% in the last 3 years. Pippin families, we've seen over 250 families, 1,000 individuals come through that programme to date. But what was really important in terms of the school environments is maximising that reach beyond the intervention. So through some of the work we've been doing through Food and Fun, we worked really closely with our local authority catering manager, and we started to review the primary school menus. There hadn't been a compliance certificate in Merthyr for over 5 years, so we felt it was a really important element to pick up post-COVID. And our dietitian worked with the catering manager to make sure that we got a compliance certificate in 2023 for our 4-week menu cycle across all of our primary schools in Merthyr. And what was really important about that was not just getting the compliance certificate, but making sure we had a really robust computer-generated allergen management matrix, so that the universal preschool meal provision really was universal to all children who wanted to access school meals. So within that time, based on the feedback that we've had, we have trained over 172 staff based in school settings, so that they are more confident to deliver health and wellbeing messages on the curriculum. And as a result of Food and Fun across Wales, what we were finding is that staff really appreciated us leaving the resource boxes that we developed in schools so that they could deliver those messages, not just during the 12 days of Food and Fun, but actually through the academic timetable as well. So we're monitoring how those boxes are being used currently, but importantly, with the input we've had in Merthyr, with the extra capacity around Food and Fun and Pippin, we're seeing that actually a quarter of that resource box usage across Wales is coming from our Merthyr primary schools. So they are using the resource boxes on the curriculum, which is a really great starting point. We've also trained up 90 staff in Merthyr in primary schools to deliver practical cooking skills, and 15 of our 22 primaries are currently delivering cooking on the curriculum or through after school clubs, very much looking at affordability, accessibility, and really quick and easy recipes to support the family with their shopping, cooking and eating habits. Thanks, Lily, if you can move the slides. So just a quick photo of one of our schools. I think there are so many positive examples of how our schools are implementing change after training and through the enthusiasm that they've then seen as a result of Food and Fun and Pippin coming into their school environment, that getting that senior leadership commitment to health and well-being has been quite overwhelming for us in Merthyr. We've seen a real want and need for that sort of whole workforce, whole school approach to really change things on a large scale. So we've certainly seen greater engagement with wider partners, health and third sector, and a lot of our national partners to actually come in and provide supporting initiatives, but also seen practical cooking skills in schools increase quite considerably, and really that commitment to make school-based changes as a result of the interventions that have been delivered over the short term. So moving on, Lily, to our next slides, in terms of achievements from bringing these two programmes together, I think one of our biggest achievements here has been that multi-agency steering group and really having a joint partnership work plan where everyone has buy-in to that shared end goal. Not that responsibility sitting with one partner alone that can seem quite daunting and really quite challenging. I think working with local authority catering and building that relationship obviously has massive reach in terms of our children and young people. But also for me, seeing the level of enthusiasm amongst our staff when they don't just understand what the food and nutrition messages are for our children, but actually understanding why it's important and the role they have in actually influencing those behaviours. To see the enthusiasm that they come away with after training and interventions within the schools, and then taking that initiative to actually dovetail it into the health and wellbeing messages on the curriculum, for us that has a far bigger reach than anything we could do in sort of dietetics or health alone. So that's been really positive for us. And as a health board, we're working towards having a CTM health and education partnership, which will hopefully strengthen this work in the coming years as well. So for me, seeing the staff behaviours and role modelling really improve has been massively important. But we've also now got an annual work plan where schools are aware of what's coming in advance. So they're very much aware of when training is coming, when we can support them with practical cooking on the curriculum, when we can do update and refresher training, how we can support them to implement that whole school approach to healthy school environments. We're currently carrying out appreciative inquiry, so sort of qualitative data collection with our schools, so that we can really feed back to our partners and our stakeholders about the challenges and also the successes that they're having with that whole school approach. Similar to the work happening in North Wales, we've been carrying out some causal loop maps and sort of mapping where we feel some of those priority causes are coming from in terms of the school environment. So we're in the process of unpicking that at the moment as well. Something that's been alluded to earlier, and I think is something that is definitely a priority for us with our health and wellbeing promoting schools team locally, is to not just look at the school food provision at lunchtime and breakfast, but actually to look at that wider provision across school events and celebrations as well. So that's certainly an aim for us moving forward. Thanks, Lily. You can skip through probably the next two slides. That slide there is really just showing the depth of partnerships that we've got across Merthyr and how that has sort of grown year on year to really be sort of a shared approach to supporting this whole school approach to better food environments. In terms of Healthy Weight, Healthy Wales, we've been fortunate enough to be recognised as a best practice case study for implementing the strategy locally. So that's been really positive for us. But I guess none of this work is possible without all of the partners in that previous slide. And I just wanted to say thank you for how open our sort of education partners have been to embracing what we're doing within public health dietetics and really get on board with influencing the school environment. Without their support and hard work, really, none of this would be possible. So thank you.
Thank you so much, Shelley. It's it's really inspiring to hear, isn't it, that synergy of different separate programs coming together to have an even bigger impact on the local population. So yeah, thank you so much. Okay. So we've got another question for you to post your responses in the chat if you can. But what do you think, having listened to all of our amazing speakers? But what do you think the biggest challenge is to school food? Is it nutrition, taste, and getting children to take up the offer of food, or actually the logistics around providing the food? Can see the responses coming in the chat there. Got to say, I think it's a combination of all of those really, but the logistics to providing school food are absolutely enormous, and as we saw earlier, involve so many different people from across the system to actually get that food provided onto the plates. And we haven't even touched on where the food's coming from and the sort of procurement side of food coming into schools to be provided. So yeah, I think logistics is a huge thing, and then we have more to do around those societal norms and what's expected, what the population expect to receive in schools, and how that contributes to children's healthy diets. So thank you, everyone. So we've come to our last slide, and we've been able to explore in rapid time. I'm very impressed that we've been able to keep to the time that we wanted to, but we've been able to explore how school food is more than just a meal, and it's a vital public health intervention that supports children's health, learning and well-being. We've seen the unique opportunities in Wales, from universal free school meals to new policy developments, and most importantly, we've been able to hear and integrate the voices of children and young people themselves throughout all of the work that we've heard about today. And we've then also been able to hear the inspiring examples of how local public health teams and local partners are already innovating to strengthen school food provision and build healthier school food environments. So our call to action for everyone on the call and beyond is really clear. We need to continue to champion school food as a cornerstone of child health. And we need to work across sectors. And I think Shelley's slide at the end there was a perfect example of all the people that we need to be working with and engaging with to create fair, supportive food environments, both inside but beyond the school gates as well. And we need to commit to listening to and involving children and young people and ensuring their perspectives shape the future of food in Wales. So together we can turn today's insights into action and create healthier futures for all children. And we'd just like to end really with understanding from yourselves what's the one thing you'll take away and act on after today. You can pop it into the word cloud. Okay, so we've got more engagement with schools, keeping going. Healthy food is more than just a choice. Networking. Yep, a better understanding of some of the different projects going on. There is a lot going on in the school food space, and I think today we focused on those projects and initiatives that are being led by, or the main sort of brings together the partners are public health teams, but there is a huge amount of other work going on that hasn't been talked about today as well. And collaboration, scaling up local action. Keep normalising healthy diets and stop using sugar foods as rewards. Absolutely. Okay, just like to go on to the next slide, Lily, and thank everyone who has contributed to our Children's Nutrition and Healthy Weight Team School Food Work Programme, but also colleagues that have contributed to the webinar and all of our great stakeholders that we've worked with across the school food system over the last couple of years. So thank you to everybody, and in particular Lucy and Lily and my team who have made this happen today. And I think we've now got time for questions. Haven't had any come through.
So we've got one there from Xanthi. Is post-16 education exempt from this?
It is and has been up until now, because Xanthi, as we have been focusing on the healthy eating in schools regulations as our sort of foundational piece that we've built upon. And I think I'll ask Lydia and Shelley to confirm, but I think the work going on as part of your subsystems is also not reaching post-16 education currently.
The work for us, certainly majority isn't going beyond post-16 education. However, just thinking specifically around food and fun, that can be delivered in primary and secondary educational settings. So there is the option to reach up to 18 years of age with that, programme of work, and obviously influence then the wider school environment.
Thanks, Shelley. Lydia, did you want to come in at all?
Sorry, I thought I was off mute, but I wasn't. Yeah, similar. The food and fitness policy that we're refreshing is for primary school, but any of the other work that we're doing and the school visits have been with secondary schools. So if they have a sixth form provision, then that would be included within that.
Yeah. Thanks, Lydia.
And then we've got one from Carrie from earlier on in the session. Do the Welsh school food standards have similar exemptions to the current English standards? And that is in relation to fundraising occasions, celebrations, rewards, and food being brought into schools by parents.
Yeah, thanks, Lily. I was going to hand that one over to Lucy, if that's okay. She's been closest to the details of the updated regulations.
Thanks, Rachel. The statutory guidance is still being reviewed at the moment, so I'm not up to date on what's the most current situation, but I do know in terms of those areas, there's an issue in terms of the legality around human rights and how much that section can be restricted within the regulations. So I know there's issues around that, but I think that the FUSES rewards has been taken out, so that won't be going in the updated statutory guidance. But in terms of the other bits, I haven't had the most recent conversations, but I do know that those are the issues around that area. It's the fact that they're kind of outside the jurisdiction of the school food standards.
Thanks, Lucy. And I'm just going to come to Jodie's question in the chat because it's slightly linked. She's asked whether packed lunches are checked or part of the policy. So packed lunches are not part of the healthy eating in schools regulations and will not be part of the new proposed standards. Schools can have individual policies around lunch boxes, but they're not part of the national regulations. And then Elaine has asked about whether there's any new developments in the provision of food during the holiday periods to combat food insecurity. So Elaine, there's the Food and Fun programme that Shelley talked about, but that is the only programme that I'm aware of. I don't know if any of our other speakers are aware of any other programmes that go on during the school holidays. No. Okay, Elaine, we can take that one away though and find out and come back to you with a more thorough response.
The only thing to say would be that any that are operating locally, perhaps through the food partnerships or through community organisations. So it might be more ad hoc rather than might be more ad hoc rather than part of a wider process.
Yeah. Okay. Thanks, Lydia. That's helpful. Okay. We've had another question. Are unintended consequences of UPFSM being looked at as part of the RISE study, from Lorna? Thanks, Lorna. Yeah, they should be included. So the RISE study is split up into 4 different work packages, and work package 2 is the one that will be working specifically with the 2 local authorities in Wales, and they will be looking at the uptake of universal free school meals in those areas, whether there has been an increase in potentially in packed lunches coming in, and what that looks like, and then also gathering the views of schools, school leadership teams, health and wellbeing promoting schools practitioners and parents. So any unintended consequences should be picked up by work package 2. Okay, any other questions from anybody? Okay. Our contact email addresses for the speakers and my team will be available on the slides that will go out and be uploaded to the network's website. So please, all of us are really happy to receive any questions from you that might come up later, or be happy to arrange to meet with anybody who'd like to discuss any of the things we've talked about today further. If there's no other questions, we'll leave it there for today.